burnout has been increasingly accepted as a very real problem in the modern workplace. The World Health Organization has now defined burnout as a syndrome resulting from chronic workplace stress that has not been successfully managed. This can be seen in the 11th edition of WHO's International Classification of Diseases, or the ICD-11. I have journalist Rei Kurohi with me in the studio today to discuss what the updated guideline means for Singapore. Welcome to the show, Rei.
Thanks, Rachel.
So Rei, we know the symptoms of burnout include feelings of exhaustion, increased mental distance from one's job, and reduced professional efficacy based on what the ICD-11 has mentioned. What does this guideline mean for the future of Singapore's healthcare system, and how will that change the way our medical professionals and our employers tackle symptoms of burnout?
So there was actually some confusion over this story because WHO spokesman earlier said this week that it was the first time that burnout's being recognized as a medical condition, but they later clarified that what it actually is a problem associated with occupation and the workplace that can affect your health or lead to you seeking treatment from a healthcare professional, but it's not a disease in itself. And in fact, it was actually listed in the previous edition of the ICD-10, but it was far less specific in its definition. So at its core, the inclusion in the ICD will basically legitimize the lived experiences of people who do feel burned out, because the ICD is kind of a guidebook, a directory, if you will, of diseases and medical conditions. So let's say you were to go to a doctor and say, "Doctor, I feel burnt out at work," but if the doctor's not able to find that entry in the ICD, then the doctor might not treat it as seriously. So this really represents a way of recognizing that this is in fact a phenomenon that's happening. But because beyond healthcare professionals, it also has implications for, let's say, insurance. So insurance agencies do refer to the ICD codings when they make policy payouts. So there is some implication for healthcare financing. That being said, because it's not a medical condition per se, it really remains to be seen how this will affect insurance or employment policies going forward.
Okay, and can you share with us what is ICD and what does it do?
Sure. So the ICD, the International Classification of Diseases, it's, as I mentioned, a kind of guidebook or database. And maintaining and updating it is one of the WHO's core functions. So it gets updated every so often. The last one, the last edition, the 10th edition, was in 1990, and the one before that, the ICD-9, 1978. So we're about up due for a new update. So it basically describes and categorizes diseases, injuries, conditions, and assigns each of them a specific code. This way, healthcare professionals can diagnose and track the conditions in a unified way. So you can have two doctors who don't speak the same language, but they can say, "Oh, this patient is 5A11," and then both doctors will know, okay, so that means type 2 diabetes.
I see.
This also allows the WHO to track and report healthcare trends around the world. And the inclusion of burnout and other conditions in the new edition is also a reflection of emerging trends. So just as we have laws that now account for emerging problems like fake news or technology-enabled voyeurism, so too in the healthcare sector you have an update of the ICD to reflect emerging healthcare problems.
And one of them that we recently saw is the video game addiction.
Yes.
Yeah. So you want to talk more about that?
So whenever new conditions are included or whenever you update an existing condition, it's really to keep your healthcare systems up to date with emerging trends and current research and understanding. So gaming addiction is just another example of this. Of course, in the 1990s, your gaming addiction might not be as widespread as it is today, but today with the ubiquity of mobile phones, tablets, and other devices, you even have toddlers who are really hooked on these kind of apps and games. So it's emerged as a problem, and its inclusion in the ICD now will allow it to be recognized, treated, and tracked more properly.
And what are other new additions in this ICD-11 that we should know?
Well, so for gaming addiction, first of all, not everyone agrees that it should be recognized as such. And in fact, a South Korean gaming company has actually slammed its inclusion because they said it violates the right of a child to play. But as a gamer myself, I actually think that this is a good move because there are definitely some games that are designed to be very deliberately addictive and to keep players in a cycle of playing the game and spending money as well on transactions. So one other inclusion in the new edition of ICD is the declassification of gender incongruence as a mental health condition. So to put it in simple terms, this means that the WHO now no longer recognizes transgender people or people who are assigned one sex at birth but identify with a different gender as having a mental health condition.
Okay.
So the implication of this is basically that the WHO is no longer saying that the status of being transgender is a medical condition, but rather that it could be associated with medical conditions like depression and suicidality, which is of course a societal problem as well. So people who have hailed the move say that it will help to destigmatize the condition and allow people to access healthcare in a better manner.
Okay, I think our viewers want to know more about the burnt out condition. Do you think it's fair that WHO classify it as an occupational hazard? How about people who work freelance and are housewives? Would that be fair if they are burnt out and they can't go to a medical professional and have that legalized?
Well, the ICD-11 is quite specific in that it's associated with the workplace and occupation, and it shouldn't be kind of just applied to any other situation willy-nilly. But I think medical professionals will tell you that it is a real thing and that it is recognized. In fact, medical professionals themselves are some of the most burnt out people in the world. And we're talking about your physicians, clinicians, nurses, caregivers. And definitely, even if you're not formally in employment, let's say you're a caregiver and your loved one has a debilitating condition, and let's say dementia, for example, is one condition where the caregivers experience higher levels of burnout. So I think regardless of whether it can be recognized as a medical condition or an occupational hazard, I think its inclusion will allow medical professionals to be more aware of the condition and to accept its legitimacy. So yes, even housewives who feel burnt out by the work that they do in the home might be able to get support.
Okay, thank you, Rei, for being on the show today.
Thanks, Rachel.
So for more news on burnout, we have Hang Out with ST talking about it tonight at around 8 p.m. And those are our top stories of the day. For more news and videos, do log on to straitstimes.com. Once again, I'm Rachel. For more news, do log on to our show at 5:30 tomorrow.